Good morning and welcome to Dialogue with Dinkins. My guest today, Errol Pierre, Assistant Vice President of Product Management at Health First, which I'm told is the largest Medicaid, Medicare health plan in the New York metropolitan area. And he's a member of the board of directors of the 100 Black Men New York City chapter. As I'm sure this audience knows, I am one of the few remaining living partners, founders of 100 Black Men. But at my age, it's no wonder. But I talked to one of our founders the other day. It was his birthday. It was Bob Mangum. He's 92. So I said, "Judge, how are you?" And he sounded terrific. But we do get on. Now, you two young fellas, here with Errol Pierre is Louis Baldwin. He's a member of the 100 Black Men, of course, and under the presidency of Roscoe Brown, became a member. Roscoe I call the fighter pilot. He's a Tuskegee airman who was the first in his group to shoot down a jet while flying a prop over Germany. He must have been maybe 21 years old. Roscoe today is 91 or 92 and still going strong. He is really one of my genuine heroes. Well, it's nice to have you here. Now, Brother Baldwin has over 30 years of corporate human resource experience with Union Carbide, Allied Chemical. Man, you've been pretty busy. You're a pretty young-looking fellow to spend all that time.
That's Louis.
Well, all right. You're looking young, too.
It's all relative.
They both, yeah, well, next, what he means by that is that next to me, everybody's young. Well, you guys got a wellness initiative. The 100 Black Men has.
Definitely.
And given my advanced years and physical condition, I'm very interested in that kind of stuff. I love children and I care about our young people, but I also care about old folks because I'm one of them. So tell me, just what are you doing?
Okay. Before I get into that, on behalf of our president, Fitzgerald Miller, our board of directors, and our membership, we want to thank you for this opportunity, Mayor Dinkins. We also, as you already mentioned, we want to acknowledge that you are one of the founders of 100 Black Men, which began in 1963 when a group of business, political, and community leaders came together in response to an issue of police brutality. This group then stayed together to address issues, concerns, and inequities in the Black community and became 100 Black Men, Inc. The success of our organization today is due to the vision and accomplishments of you and other founders 50 years ago. So we thank you for that. Now, as an organization, we focus on four main areas that impact our community. One is education, two is mentoring, three is economic empowerment, and the third is health and wellness. Our organization is known for education, mentoring. We began the Eagle Academy. We do mentoring with students, and we have a scholarship program. But most recently, the organization is placing more emphasis on health and wellness. Errol and I recently came back from the 100 Black Men of America conference, and the entire conference was focused on health and wellness. Now, June is Men's Health Month, which is a time when healthcare providers, public policymakers, the media, and other medical-related organizations to be focused on men's health care issues. During the month of June and throughout the year as well, 100 Black Men focuses on making Black men aware of preventable health problems, encouraging them to have health screenings and to seek early treatment of diseases. We also promote healthy diet and exercise. Cancer, in particular, is of high concern to us because it's killing our fathers, our brothers, our uncles, our cousins, and our friends. Early detection and living a healthy lifestyle are keys to saving lives. Obesity, smoking, bad diet, high cholesterol, stress, and a lack of physical activity are all risk factors for cancer. In February this year, the American Cancer Society released a cancer statistics about African Americans that indicated that the death rate for all cancers combined are 33% higher for black men and 16% higher for black women compared to white men and white women. Furthermore, they indicated that the incidence rates for prostate cancer is 40% higher for black men in comparison to white men, and the death rate is 2.5 times higher for black men than white men. The incident rate for colorectal cancer is 23% higher for black men in comparison to white men, and the death rate is 31% higher for black men in comparison to white men. What is so upsetting about these statistics is that prostate cancer has a high cure rate if detected early, and colorectal cancer is preventable. The key for both of these are screening. For prostate cancer, the medical community at large recommends screening at age 50. We actually recommend to start earlier than that, at age 40 for African Americans. Let me use myself as an example. I have continually had prostate screenings. It involves two things. It involves, one, a PSA blood test, which is very simplistic, and the other is a digital exam, which many men have an issue with. Now, I will admit from my own personal experience that it is uncomfortable. However, it beats dying from prostate cancer hands down. Okay? In regards to colorectal cancer, everyone should get screened, both men and women should get screened starting at age 50. Now, the process involves inserting a flexible tube into the rectum, which in and of itself sounds painful. In my case, when I turned age 50, I delayed 2 years waiting to have the test done just because of the fear of the potential pain. So when I finally got up enough courage to do it, I went to the doctor's office, was sitting on the examining table waiting. Doctor came in, gave me an injection, which was a sedative, and asked me to lay down on the examining table. So I laid down, and so I'm waiting for the procedure to begin.
He told you it was over.
And the nurse comes in and says, "You can get dressed." And they haven't done anything. What are you talking about? You haven't done anything. No, Mr. Baldwin. It's done. So I say that to say there's absolutely no.
No, I know exactly what you mean. I've had the same experience.
Yeah.
Indeed, one of the hospitals, forget which one now, involved me in a promotional thing where they took photographs of me in a gown, and the caption they were going to use is, "I'm tough enough to do this." And I told them, it seemed to me that's exactly wrong. You don't need to be tough, because it's as you just described. It's very simple. Before you know it, it's over.
Right.
And moreover, they can prevent cancer, because during that exam, if they find some polyps in it, they can remove them, and it's light stuff. But most people, because the description of it is such as to turn a lot of people off. Now, I've had many, because I'm older, and the thing that on prostate cancer, for years I'd go get my PSA and I'd check it, and then it was always around 2, and then one exam it spiked to 5. So urologist sent me to an oncologist, and he said, "Well, we have to do a biopsy." And of course, that sounded awful, but it wasn't so bad. And then they told me that I was a Gleason 6. So I said, "What the hell does that mean?" and they explained to me that this is sort of moderate. And at my age, it's not growing fast. So among the things one can do, chemotherapy, of course, surgery. None of that's indicated for somebody of my age. So they said, what do I do? They said, careful surveillance. Just keep an eye on it. And as recently as a couple of days ago, I get blood tests regularly for all kinds of things, and always include PSA, and it was fine. But I can say that I have prostate cancer. They say that everybody is going to die with it. Question is whether or not you die from it. And but you young guys, you don't need to worry about this stuff.
But I think the issue really is talking about it. So some of the health and wellness campaigns we do, we'll go into a men's ministry church and have these discussions. And I'm grateful that Louis shared his story, you shared your story, because the more black men talk about it, the more the fear goes away, and the more that they feel motivated to actually go to the doctor and get these screenings.
Well, screenings are so important, and it is an